Welcome to today's video on physical activity and chronic kidney disease, or CKD for short. In this video, we will be looking at the impact of CKD on physical activity, the impact of physical activity on CKD, some of the physiological processes that underpin this, and some practical considerations for clinicians. Chronic kidney disease comprises a group of progressive and irreversible kidney disorders that affect around 8% of the UK population. The commonest cause of CKD in the UK are diabetes and hypertension. CKD is a progressive illness, and progression of the disease is associated with lower levels of physical activity, with the lowest levels amongst end-stage CKD patients on dialysis. This decline may be explained by the increased fatigue and pain and reduced muscle mass and physical function experienced by patients with CKD. Interestingly, we can see this relationship is at least partially reversible, as patients who receive a kidney transplant have a moderate increase in their physical activity levels. This diagram demonstrates how a sedentary lifestyle can exacerbate CKD progression. A sedentary lifestyle directly leads to an increased BMI and a reduced cardiorespiratory fitness. These two factors can then lead on to more issues, including increased blood pressure and reduced glucose tolerance, subsequently causing a rise in intraglomerular pressure and atherosclerosis. This, in turn, causes further renal damage and a consequent worsening of CKD progression. So why does this matter? Loss of kidney function is associated with the development of numerous comorbidities such as cardiovascular disease, type 2 diabetes and obesity, an increased mortality, systemic inflammation, and symptoms such as muscle wasting and fatigue. Research, although limited, suggests a beneficial effect of exercise and physical activity in CKD. Higher levels of physical activity are associated with slower decline in kidney function, reduced likelihood of renal replacement therapy such as dialysis, and a reduced mortality. This table shows some of the evidenced benefits of physical activity at different stages of CKD. For all groups, there is an increased aerobic capacity and health-related quality of life with activity. Research has also shown us that non-dialysis patients can improve their blood pressure control, their muscular strength, and their walking capacity, with hemodialysis patients receiving similar benefits. These benefits are reflected in the NICE guidance. NICE encourages people with chronic kidney disease to take regular exercise, achieve a healthy weight, and stop smoking. When approaching exercise in CKD, it is important to do so safely. Joint and musculoskeletal problems are common consequences of exercise initiation, so it is important to include flexibility and stretching exercises and a long warm-up and cool-down with graded exposure to exercise. If the patient has an arteriovenous fistula, this arm can also be fully exercised as long as pressure is not placed directly on the fistula and weights used in resistance training are limited. Contraindications to exercise are mostly due to acute complications such as electrolyte abnormalities, recent ECG changes, and pulmonary congestion. In these situations, exercise should be halted. It is important to recognize these precautions and understand the absolute contraindications to physical activity in CKD. However, on balance, performing regular physical activity at an appropriate moderate intensity probably carries more benefits than risks. To conclude, exercise is beneficial in chronic kidney disease and should be used as an adjunct to medical management. Practically speaking, physical activity should be incorporated into a patient's lifestyle and increased gradually over time. Identification of attainable goals which are meaningful, appropriate, and specific to an individual is important and will help define a realistic plan of action. Thanks for watching. For more information, please see the links presented shortly. Please remember that almost all patients can benefit from being more active, but the largest benefits are seen by improving activity in those who are the most inactive.